Subsection 4.40, functional loss. Disability of the musculoskeletal system is primary inability due to damage or infection in parts of the system to perform the normal movements of the body with normal excursion, strength, speed, coordination, and endurance. It is essential that the examination on which ratings are based adequately portray the entomological damage and the functional loss with respect to all these elements. The functional loss may be due to absence of part or all of the necessary bones, joints, or muscles, or associated structures, or to deformity, adhesions, defective innervations, or other pathology. Or it may be due to pain supported by adequate pathology and evidenced by the visible behavior of the claimant undertaking the motion. Weakness is as important as limitation of motion, and a part which becomes painful on use must be regarded as serious disabled. A little used part of the musculoskeletal system may be expected to show evidence of disuse, either through atrophy, the condition of the skin, absence of normal callicity, or the like. 4.45, the joints. C. Weakened movement due to muscle injury, disease, or injury of peripheral nerves, divided or lengthened tendons, etc. D. Excess fatigability. C. Incoordination, impaired ability to execute skilled movement smoothly. F. Pain on movement, swelling, deformity, or atrophy, or disuse. Instability of station, disturbance of locomotion, interference with sitting, standing, and weight bearing are related considerations. For the purpose of rating disability arthritis, the shoulder, elbow, wrist, hip, knee, and ankle are considered major joints. Multiple involvements of the interphalangeal, metacarpal, and carpal joints of the upper extremities, the interphalangeal, metatarsal, and tarsal joints of the lower extremities, the cervical vertebrae, the dorsal vertebrae, and the lumbar vertebrae are considered groups of minor joints, ratable on a parity with major joints. The lumbosacral articulation and both sacroiliac joints are considered to be a group of minor joints, ratable on disturbance of lumbar spine function. Painful motion. 4.59. With any form of arthritis, painful motion is an important factor of disability. The facial expressions, winching, etc. on pressure manipulation should be carefully noted and definitively related to affecting joints. Muscle spasms will greatly assist the identification. Sciatic neuritis is not uncommonly caused by arthritis of the spine. The intent of this schedule is to recognize painful motion with joint or particular pathology as productive of disability. It is the intention to recognize actual painful, unstable, or misaligned joints due to healed injury as entitled to at least the minimum compensation component rating, and I think it's supposed to be 4, the joint. Crepitation either in the soft tissues such as the tendons or ligaments, or crepitating within the joint structures should be noted carefully as joints of contact which are diseased. Flexion elicits such manifestations. The joints involved should be tested for pain on both active and passive motion, in weight bearing and not weight bearing, and if possible with a range of the opposite undamaged joint. 4.71. A. 5239 Spondylolisthesis or segmental instability. And it says, please note, it is stated that my specific condition is not on the charts. So this is a chart I believe the VA to be using to grade my lower back causation disability. And I've asked them to see 420. So that's what that writing is. With or without symptoms such as pain, whether or not it radiates, stiffness or aching in the area of the spine affected by residuals of injury or disease. Unfavorable ankylosis of the entire spine, 100%. Unfavorable ankylosis of the entire thoracic lumbar spine, 50%. Unfavorable analog of the entire cervical spine, or forward flexion of the cervical spine, 30 degrees or less. Or favorable analysis of the entire thoracic lumbar spine, 40. Forward flexion of the cervical spine, 15 degrees or less. Favorable analysis of the entire cervical spine, 30. Forward flexion of the thoracic lumbar spine greater than 30 degrees but no greater than 60 degrees, or forward flexion of the cervical spine greater than 15 degrees but not greater than 30 degrees, or the combined range of motion on the thoracic lumbar spine not greater than 120 degrees, or the combined range of motion of the cervical spine not greater than 170 degrees, or muscle spasms or guarding severe enough to result in an abnormal gait or abnormal spine contour, such as scoliosis, reversed lordosis, or abnormal craposis, I guess. I know I got that one wrong. But that's a lot to get in a one sitting. You got to get your pencil and paper out and start doing some math. It continues. Forward flexion of the thoracic lumbar spine greater than 60 degrees but not greater than 85 degrees, or forward flexion of the cervical spine greater than 30 degrees but not greater than 40 degrees, or combined range of motion of the thoracic lumbar spine greater than 120 degrees but not greater than 235 degrees, or combined range of motion of the cervical spine greater than 170 degrees but not greater than 335 degrees, or muscle spasms, guarding or localized tenderness not resulting in abnormal gait or abnormal spinal contour, or vertebrae body fracture with loss of 50% or more of the height. It would be a 10. So this is basically describing kind of how this goes. Now, it continues with a note. Note 1 is evaluate any associated objective neurologic abnormalities, including but not limited to bowel or bladder impairment, separately under the appropriate diagnostic code. Note 2, see also plate 5. For VA compensation purposes, normal forward flexion of the cervical spine is 0 to 45. The extension is 0 to 45. Left and right lateral flexion is 0 to 45 degrees. And left and right lateral rotation is 0 to 80 degrees. Normal forward flexion of the thoracic lumbar spine is 0 to 90 degrees. The extension is 0 to 30 degrees. Left and right lateral is 0 to 30 degrees, and the left and right lateral rotation are 0 to 30 degrees. The combined range of motion refers to the sum of the range of forward motion of the cervical spine is 340 degrees, and the thoracic lumbar spine is 240 degrees. The normal range of motion for each component of spinal motion provided in this note are the maximum that can be used for calculation of the combined range of motion. Note 3, in exceptional cases, an examiner may state that because of age, body habitus, neurologic disease, or other factors, not the results of disease or injury of the spine, the range of motion of the spine in the particular individual should be considered normal for that individual, even though it does not conform to the normal range of motion stated in Note 2, providing that the examiner supplies an explanation. The examiner's assessment that the range of motion is normal for that individual will be accepted. 4. Around each range of motion measurement within the nearest 5 degrees. Note 5. For VA compensation purposes, unfavorable ankylosis in the condition in which the entire cervical spine, the entire thoracic lumbar spine, or entire spine is fixed in flexion or extension, and the ankylosis results in one or more of the following: difficult walking because of limited line of vision, restricted opening of the mouth and chewing, breathing limited to diaphragmatic respiration, gastrointestinal symptoms due to pressure on the costal margin of the abdomen, dyspnea or dyspareunia, anteroaxial or cervical subluxation or dislocation, or neurologic symptoms due to nerve root stretching. Flexation of a spinal segment in neutral position 0 degrees always represents favorable ankylosis. Note 6. Separately evaluate disability of the thoracolumbar and cervical spine segments except when there is unfavorable ankylosis in both segments, which will be rated as a single disability. (4.71a) 5242. 5242, degenerative arthritis of the spine, and they want you to also see the diagnostic code 5003. And that's another note from me, basically saying, please note it is stated that my specific condition is not on the chart, so this is the chart I believe the VA is using to grade my lower back causation disability. See 4.20, analogous rating, with or without symptoms such as pain.